You picked that breed because you loved the way it looked. Maybe the squished face, the giant ears, the barrel chest, the silky coat that seems to flow when they run. You did your research. You read the forums. You asked around. And everyone told you that breed was great with families, easy to train, full of personality. Nobody told you what was happening on the inside. And this is not a video about blaming breeders or shaming dog owners. This is a video about what the popularity of certain breeds has done to their bodies, slowly, quietly, over decades of selective breeding, and what that means for the dog sleeping at your feet right now. There are 10 breeds on this list. Some of them will surprise you. Some of them you already own. And by the end of this video, you are going to understand your dog's body in a way that most owners never do, and you are going to know exactly what to watch for before it becomes a crisis. Start with the one that almost nobody talks about openly. The French Bulldog is currently one of the most popular breeds on the planet. In multiple countries, it holds the #1 spot. And if you own one, you already know why. They're funny and stubborn and deeply attached to their people. They make you feel like the most important person in the room. But here is what is happening inside that adorable face. The French Bulldog was bred over generations to have a shortened skull. The technical term is brachycephalic, meaning flat-faced. What that word does not communicate is what it actually costs the dog. The nostrils are often so narrow that the dog is working harder to pull air through them than you would work to breathe through a coffee stirrer. The soft palate at the back of the throat is often too long for the shortened skull it sits inside, so it partially blocks the airway with every breath. The trachea itself can be undersized. The result is a condition called brachycephalic obstructive airway syndrome, BOAS. And in French Bulldogs, studies estimate that more than half of the breed is affected to a clinically significant degree. More than half. Here is what that means in practice. Your Frenchie is not panting because they are hot. They are panting because they cannot breathe efficiently. That snoring you find adorable is not a quirk. It is the sound of a dog working hard for every breath, every night, for their entire life. In hot weather, in moments of excitement, during play, that dog is always one step closer to a breathing crisis than you realize. The surgery to correct it exists. It helps, but it should not have to exist. And the French Bulldog is not alone in this. The English Bulldog carries the same brachycephalic burden, but with an additional layer. The English Bulldog's body has been so dramatically altered from its original working form that most of them cannot reproduce without human assistance. The puppies' heads are too large to pass through the birth canal naturally. The breed survives largely through cesarean sections. Let that sit for a moment. A species that cannot reproduce without surgical intervention is a species whose body has been pushed past its biological limits. Beyond the airways, English Bulldogs carry extraordinary weight on a frame built for a different kind of dog. Their joints, especially the hips and elbows, are under pressure that compounds with every year of their life. Hip dysplasia rates in the breed are among the highest of any breed surveyed. Skinfold dermatitis, painful infections in the folds around their face and tail, is almost universal without rigorous daily cleaning that most owners are never told they need to do. But here's where it gets interesting. These are not fringe breeds. These are not rare dogs owned by a handful of enthusiasts. These are the breeds dominating social media, filling pet stores, appearing in advertisements. Their suffering has been aestheticized into charm. The wheeze is content. The waddle is a personality trait. And the veterinary bills come later, quietly in private. Move to a breed most people think of as robust. The Labrador Retriever. Sturdy, athletic, built for water and work. Everything about the Labrador suggests physical health, and compared to the brachycephalic breeds, they are. But the Labrador has a problem that runs deeper than their skeleton. It runs through their DNA. A 2016 study published in Cell Metabolism identified a specific gene variant in Labradors called POMC, pro-opiomelanocortin. In dogs who carry this variant, the signal that tells the brain the body is full after eating is significantly impaired. The dog does not feel satiated the way other dogs do. They eat. The signal fires weakly. They eat again. They are not undisciplined. They are not poorly trained. Their brain is not receiving the message that other dogs' brains receive. Roughly 1 in 4 Labradors carries this variant. And in Labrador assistance dogs, the ones specifically selected for trainability, which often correlates with food motivation, the rate is even higher. The consequence is an obesity epidemic inside one of the world's most beloved breeds. And obesity in Labradors does not look the way it looks in humans. It loads silently onto joints that are already predisposed to dysplasia. It compresses a spine prone to intervertebral disc disease. It strains a heart that will already face its own challenges in the dog's senior years. The Labrador who seems fine, who runs in the yard, who brings you the ball 50 times without stopping, may be accumulating damage with every extra pound they carry. This is where most people get it wrong. They see energy and assume health. But the Labrador's eagerness to move is not a reliable signal of their physical condition. Their brain will push their body past what their joints can sustain, partly because of that same drive that makes them wonderful. Now go smaller. The Cavalier King Charles Spaniel. A breed that looks like a painting come to life. Soft, silky, gentle, beyond description. And carrying, in the opinion of many veterinary cardiologists, one of the most heartbreaking breed-specific conditions in the canine world. Literally, mitral valve disease, MVD. The mitral valve is the valve between the upper and lower chambers of the left side of the heart. In Cavaliers, this valve degenerates. The tissue thickens. The valve stops closing cleanly. Blood begins to flow backward where it should not flow at all. The heart compensates by working harder and harder until it cannot compensate anymore. Studies have shown that by the age of 5, approximately half of all Cavaliers show early signs of this disease. By 10 years old, virtually the entire breed is affected to some degree. This is not a minority health concern buried in a footnote. This is the most studied cardiac condition in veterinary medicine, and it lives inside almost every Cavalier on Earth. What owners often do not know is what the early signs sound like, not look like, sound like. A soft murmur, detected only with a stethoscope, is the first sign. Most owners never hear it. Most owners are not told to have their Cavalier's heart assessed annually by a cardiologist from an early age. By the time symptoms appear, coughing at night, reduced exercise tolerance, difficulty breathing, the disease has often progressed significantly. The Cavalier deserves better than late detection. And the science gets stranger when you look at what else is happening inside that small skull. Syringomyelia, the word itself sounds severe because it is. It refers to fluid-filled cavities that form within the spinal cord. In Cavaliers, it develops as a direct consequence of a skull that is too small for the brain it contains. The brain is partially pushed through the opening at the base of the skull, a condition called Chiari-like malformation, and this disrupts the normal flow of cerebrospinal fluid around the spinal cord. The result is pain. Chronic, invisible, often misread pain. The dog scratches at their neck and shoulders in the air, not touching skin, just clawing at nothing, because they feel something they cannot reach. They vocalize without obvious reason. They become sensitive to touch around the head and neck. Owners often assume anxiety or quirky behavior or a bad day. What they are watching is a neurological condition that causes a sensation described in human patients as feeling like water moving through the spine. Some estimates suggest more than 70% of Cavaliers have the structural malformation. Not all develop symptoms, but many do. And many owners never connect the dots. Cross to a working breed, the German Shepherd. Intelligent, loyal, one of the most versatile working dogs ever developed. And progressively, over the last few decades of show line breeding, one of the most structurally compromised large breeds in existence. The angulation of the German Shepherd's hindquarters, the steep slope from hip to hock that show judges once rewarded, has moved the breed away from the balanced, upright structure of the original working dog. That slope changes the biomechanics of every step. It loads the hips and lower spine differently than a more upright stance would, and the German Shepherd already carries a significant genetic predisposition to degenerative myelopathy, a progressive neurological disease that destroys the nerves controlling the hind limbs. Degenerative myelopathy begins as wobbling, a slight weakness in the back legs. Owners often attribute it to arthritis, to age, to a long day, but it progresses. Over months to years, the weakness moves forward through the body. There is no cure. There is no reversal. Management can slow progression, but it cannot stop it. A DNA test exists. It can tell you whether a dog carries the gene variants associated with the disease. Responsible breeders test for it. Not all breeders are responsible. And the owners of German Shepherds who begin to notice that slow wobble in their dog's back end deserve to know what they may be watching unfold. Here is what is happening underneath all of this. Every breed you love was created by humans. That statement sounds obvious, but what it means is less obvious than it seems. Dogs did not evolve these traits. They did not develop flat faces because flat faces helped them survive. They did not develop undersized skulls because neurological compression offered an advantage. They did not develop hearts that reliably fail by middle age because cardiac disease improved their fitness. Every one of these traits was selected because humans found it appealing or useful or profitable. The dog had no say. The dog's body bore the cost. And the dog's body is still bearing it in your home right now, in breeds so normalized that it never occurs to most owners to question the body their dog was born into. This is not a reason to stop loving these breeds. This is a reason to pay attention in a way you were never taught to pay attention. Which brings us to the warning you need to hear. A dog in pain does not always look the way you expect pain to look. They do not always cry. They do not always limp dramatically or refuse to move. Dogs are stoic in ways that regularly mislead even experienced owners. What chronic pain often looks like in dogs is a subtle behavior change. A dog who used to greet you at the door now stays on the bed. A dog who used to jump onto the couch now stands beside it and waits. A dog who used to race to the food bowl now walks to it slowly. A dog who used to initiate play now watches from across the room. These are not personality shifts. These are not the dog getting older and calmer. These are communications from a body that is struggling, delivered in the only language available to an animal that cannot tell you where it hurts. The dachshund's long spine and short legs, bred for going underground after prey, make intervertebral disc disease one of the breed's most common crises. 1 in 4 dachshunds will experience a spinal disc event in their lifetime. Some will recover, some will not. And the first sign is often a dog who seems stiff or reluctant to go upstairs or slightly off in a way you cannot quite name. The Doberman's deep chest makes them one of the breeds most affected by dilated cardiomyopathy, a disease where the heart muscle weakens and the chambers enlarge, reducing the heart's ability to pump. It can be present for years before symptoms appear, and in some Dobermans, the first symptom is sudden cardiac death. The Cocker Spaniel's long, heavy ears create a warm, dark, poorly ventilated canal that becomes a near-perfect environment for bacterial and fungal infections. Chronic ear disease in Cockers is so common it is almost expected, but it does not have to be. Early intervention, appropriate ear care, and understanding of the anatomy can prevent years of pain that far too many Cockers endure silently. This is where the information becomes something more than information. If you own one of these breeds, you're not helpless, but you cannot help what you do not know. Annual cardiac evaluations for Cavaliers, neurological monitoring for German Shepherds. Weight management with the seriousness of a medical intervention for Labradors. Breathing assessments for Bulldogs and Frenchies before the hot months, before the exciting walks, before the moments that push a compromised airway into a crisis. These are not optional luxuries for devoted owners. These are the baseline of responsible care for dogs whose bodies came to you already carrying a burden you did not put there and cannot fully remove, but can absolutely manage. And the breed you choose next, if you ever choose again, deserves to come from breeders who health test, who screen for the conditions specific to that breed, who can show you the results, who breed for longevity and soundness, not for the silhouette that wins a ribbon. Your dog did not choose their body. You chose it for them, in the way that every person who has ever purchased a puppy has made that choice, carrying forward, one transaction at a time, the demand that shapes what breeders produce. That is not a guilt trip. It is a fact about how breeds change over time. And it is also a fact about how breeds can change back, toward health, toward soundness, toward bodies that work the way bodies are meant to work. The dog at your feet right now is counting on you to understand them. Not just their personality, not just their preferences, their body. The remarkable, imperfect, human-shaped body they were born into. Learn it, watch it, and speak up for it loudly when something changes, because they cannot.